Hello, my name is Sharonda Perry, and I am the owner of Comfort Care Home Care in Arlington. And today we're going to talk about hearing in older adults. We have four things on our agenda today. The first one is to overview hearing loss and coping with it, tips for speaking to someone with hearing loss, helpful devices to help with hearing loss, and resources for more information. Hearing loss is a common problem caused by noise, aging, disease, and heredity. People with hearing loss may find it hard to have conversations with friends and family. They may also have trouble understanding a doctor's advice, responding to warnings, and hearing doorbells and alarms. Approximately 1 in 3 people between the ages of 65 and 74 have some sort of hearing loss, and nearly half of those older than 75 have difficulty hearing. But because many people feel embarrassed by this condition, they may not want to admit that they have trouble hearing. Older people who can't hear well may become depressed, or they may withdraw from others because they feel frustrated or embarrassed about not understanding what is being said. Sometimes older people are mistakenly thought to be confused, unresponsive, or uncooperative because they don't hear so well. Hearing problems that are ignored or untreated can get worse. If you have a hearing problem, see your doctor. Hearing aids, special training, certain medicines, and surgery are some of the treatments that can help. If your loved one has untreated hearing loss and you find yourself constantly having to translate, explaining to them what they misheard, you may be compensating for them. Although you're trying to be helpful in the long run, compensating can be harmful to both of you. When it comes to persistent, untreated hearing loss, help can turn into a habit. When a family member trying to help too often begins repeating words, sentences, then rephrasing and interpreting thoughts and ideas that were missed, it's way past time for professional help. The desire to assist is a natural inclination born out of love and kindness. We don't want loved ones to appear foolish, disinterested, bored, or embarrassed, and for these reasons and more, we tend to intervene and compensate for a loved one not hearing well. So here's a discussion question to ask yourself. Are you compensating for a loved one's hearing loss? These are some of the ways that the person with hearing loss and people engaging with the person may attempt to compensate for the perceived deficit in communication. Speaking louder. Those with hearing loss may speak louder because they can no longer hear themselves normally. Acting as an interpreter. Loved ones often repeat or rephrase to help family members participate in the conversation. Isolation. As hearing worsens and communication becomes more difficult, the person with hearing loss and their significant other often opt to be isolated. Resistance. The person with the hearing loss may resist treatment or seeking any type of help to assist with the hearing. And then hope. The family member or the person with the hearing loss may just hope that the family members would just stop asking them to seek treatment. The most common type is age-related hearing loss. However, many conditions can interfere with the conduction of sound vibrations to the inner ear and their compensation to electrical impulses for conduction to the brain. Next, we will talk about some of the most common age-related hearing issues. Age-related hearing loss comes on gradually as a person gets older. It seems to run in families and may occur because of changes in the inner ear and auditory nerve. Hearing loss may make it hard for a person to tolerate loud sounds or to hear what others are saying. Age-related hearing loss usually occurs in both ears, affecting them equally. The loss is gradual, so someone with this may not realize that he or she has lost some of his or her ability to hear. Tinnitus or tinnitus is also common in older people. It is typically described as ringing in the ears, but it also can sound like roaring, clicking, hissing, or buzzing. It can come and go. It might be heard in one or both ears, and it may be loud or soft. Tinnitus is sometimes the first sign of hearing loss in older adults. Tinnitus can accompany any type of hearing loss and can be a sign of other health problems such as high blood pressure, allergies, or as a side effect of some medications. Tinnitus is a symptom, not a disease. Something as simple as a piece of earwax blocking the ear canal can cause tinnitus, but it can also be the result of a number of health conditions. Loud noise is one of the most common causes of hearing loss. Noise from lawnmowers, snow blowers, or loud music can cause damage to the inner ear, resulting in permanent hearing loss. Loud noise also contributes to tinnitus. You can prevent most noise-related hearing loss. Protect yourself by turning down the sound on your stereo, television, or headphones, moving away from loud noise, or using earplugs or other ear protection. Earwax or fluid buildup can block sounds that are carried from the eardrum to the inner ear. If wax blockage is a problem, talk with your doctor. He or she may suggest mild treatments to soften the wax. A punctured eardrum can also cause hearing loss. The eardrum can be damaged by infection, pressure, or putting objects in the ear, including cotton-tipped swabs. See your doctor if you have pain or fluid draining from the ear. Health conditions common in older people, such as diabetes or high blood pressure, can contribute to hearing loss. Viruses and bacteria, including ear infections, a heart disease, stroke, brain injury, or a tumor, may also affect your hearing. Hearing loss can also result from taking certain medications, and these medications can damage the inner ear, sometimes permanently. Some of these drugs include medicines used to treat serious infections like cancer or heart disease. Some antibiotics can cause hearing loss. Even aspirin at some dosages can cause problems. Check with your doctor if you notice a problem while taking a medication. And lastly, heredity. Heredity can cause hearing loss as well, but not all inherited forms of hearing loss take place at birth. Some forms can show up later in life. For example, a hereditary disease, which is an abnormal growth of bone, prevents structures within the ear from working properly. Coping with hearing loss. If you have trouble hearing, you should let people know you have a hearing problem. Ask people to face you and speak more slowly and clearly. Ask them to speak louder without shouting. Pay attention to what is being said and to facial expressions or gestures. Let the person talking know if you do not understand what he or she said. Ask the person speaking to reword a sentence and try again. Find a good location to listen and place yourself between the speaker and the sources of noise. Here are some tips on how to talk to someone with hearing loss. First, you can include them in the conversation. Find a quiet place to talk. Stand in good lighting and use facial expressions or gestures to give clues. Face the person and speak clearly. Maintain eye contact. Speak a little more loudly than normal, but don't shout. Speak slowly but naturally. Speak at a reasonable speed. Do not hide your mouth. Repeat yourself if necessary using different words. Try to make sure one person talks at a time. Be patient, stay positive and relax, and ask how you can help. Getting help with hearing loss. There are several devices and systems that can assist people with hearing loss and their families. Let's discuss these helpful tools. Hearing aids. Your doctor or specialist may suggest you get a hearing aid. Hearing aids are electronic, battery-run devices that make sounds louder. There are many types of hearing aids. Before buying a hearing aid, find out if your health insurance will cover the cost. Also, ask if you can have a trial period so you can make sure the device is right for you. An audiologist or hearing aid specialist will show you how to use your hearing aid. Assistive listening devices, ALDs, are devices that can be used along with hearing aids to enhance the listening experience and provide extra help in challenging listening situations. ALDs can help you hear better while having a conversation on the phone, watching television, attending live events, and even help you hear your alarm clock in the morning. While ALDs are not a replacement for hearing aids, they can be used when hearing aids do not provide enough amplification or when hearing aids cannot be used at all due to physical limitations. Alerts and mobile apps. Alert systems can work with doorbells, smoke detectors, and alarm clocks to send you visual signals or vibrations. For example, a flashlight can let you know someone is at the door or the phone is ringing. Some people rely on the vibration setting on their cell phones to alert them to calls. For example, for a smoke alarm going off in another room, Sound Alert is a device that can alert you via notifications, vibrations, and flashing lights on your smartphone or tablet when any pre-programmed program sound goes off in the house, such as a smoke alarm, doorbell, phone ringing, or microwave ding. Cochlear implants can help some people with hearing loss. Cochlear implants are electronic devices for people with severe hearing loss. They don't work for all types of hearing loss. A cochlear implant is an electronic device that partially restores hearing. It can be an option for people who have severe hearing loss from inner ear damage or who are no longer helped by using hearing aids. Unlike hearing aids, which amplifies sound, a cochlear implant bypasses damaged portions of the ear to deliver sound signals to the hearing or auditory nerve. Cochlear implants use a sound processor that fits behind the ear. The processor captures sound signals and sends them to a receiver implanted under the skin behind the ear. The receiver sends the signals to electrodes implanted in the snail-shaped inner ear, which is the cochlea. The signals stimulate the auditory nerve, which then directs them to the brain. The brain interprets those signals as sounds, though these sounds won't be just like normal hearing. It takes time and training to learn to interpret the signals received from a cochlear implant. Within a year of use, most people with cochlear implants make considerable gains in understanding speech. The American Speech Language Hearing Association recommends that adults be screened by an audiologist once per decade and every 3 years after the age of 50, or more frequently in those with known exposures or risk factors associated with hearing loss. One of the most used tools is called the Hearing Handicap Inventory for the Elderly Screening version. It's a 10-item questionnaire developed to assess how an individual perceives the social and emotional effects of hearing loss. This test screens for the perceived disability and is a good place to start for hearing loss screening. Speak with your doctor and visit an audiologist to have this test. For more information about hearing loss, National Institute on Deafness, and other communication disorders, call 1-800-241-1044 or 1-800-241-1055. The American Speech Language Hearing Association phone number is 1-800-638-8255, or you can go to the Action Center at asha.org. The American Tinnitus Association is 1-800-634-8978 or tinnitus@ata.org. The Hearing Loss Association of America is 301-657-2248, or you could also go to www.hearingloss.org. Thank you for watching.